Hey, Dr. Tyler Williams at Sleep SLC, and you're here because you have some questions on your sleep and how to get better sleep and maybe some difficulty falling asleep and what that issue may be. And you know, sleep's one of those powerful things that can really be life-changing, especially if you struggle with sleep or your partner struggles with sleep, which could cause you to struggle with sleep. And there are so many things available to us that it's pretty overwhelming sometimes, from supplements to medications to pillows to beds to devices that you wear, surgery, lifestyle changes, that it's not always easy to navigate what's the best and most holistic approach for you. So a couple things that I've found that may be helpful for you I'd like to share in this video and kind of walk you through things that we found that worked well for our patients and things that have not worked so well. And there was a study done recently by a large group of psychologists, and they found that when people were missing even 1 to 2 hours of sleep per night, that it caused a lot of problems, including anxiety, increased heart rate, depression, moodiness, just to name a few. And what they did is they went through 154 studies that spanned about 40 years. So it was very in-depth, and it covered a lot of time and a lot of different studies using different approaches. And so, you know, a lot of people come to find us because they say, I'm just so tired of not getting good sleep, or I just can't deal any longer with daytime grogginess, or feeling crummy even though I was in bed for 9 hours last night. So some things that might be able to help you include, you know, what supplements do, what they don't do, what different devices do, what they don't do, and those kind of things. The first thing is, the primary reason people come and see us is because they snore or they've been diagnosed with some type of sleep breathing issue. And that means that when you lie back, your tongue blocks part of your airway, and it causes you to snore or gasp or suddenly wake up or feel like you coughed during the night and you weren't even sick. And that's usually because you're not getting enough oxygen. And historically, this would happen when, you know, someone was overweight or very muscular and had a really large neck with extra muscle, extra fat, those kind of things that would encroach or crowd out your airway. But now we find a lot of times people are even underweight sometimes that come and see us. And that can be small mouth, that can be missing teeth, that can be the back of your throat isn't as tight as it once was from aging or diet or not exercising, those kind of things. So there's a combination of things. But a lot of times, you know, a sleep coach or someone who's expert in, hey, here's the things you should not do before bed, here's the things you should do before bed. And those include getting off devices an hour before bed, making your room calm and relaxing, using lighting that's conducive to sleep, not lots of bright white or blue light, artificial light, such as that comes from a lot of devices. That's why a lot of devices now have the warm or the night light mode, where it gets warmer, more orange or amber colored light. It's because that light's more soothing and relaxing, and that can help as well. As far as your breathing, there are generally 3 things you can do to treat that, and that can include a CPAP, which is an air mask that you wear that continuously blows air to help you breathe. They work well, but a lot of people feel very claustrophobic or feel like they can't wear them. And so a lot of times they come and see us for the second option, which is an oral appliance, and it's a special mouthpiece you wear that keeps your tongue in a position so you can breathe better, you get more oxygen. If you have sinus issues, if you have nasal issues, if you get stuffy noses easy, runny noses easy, this can improve those, but it's really not your nose as much as it is your throat and your mouth. That's where the issue is happening. So those things can help as well, especially during daytime. Focusing on breathing through your nose rather than your mouth can really help not just your overall sense of well-being, but it helps your teeth and gums and throat and tongue stay healthier. We find less cold and flu because your nose is a filter for bacteria and viruses that your mouth cannot filter. And so those can be helpful. Your third option is surgery, and that can involve an electronic implant. It's kind of like a pacemaker installed. It can involve jaw surgery, throat surgery, different types of surgery. So really, you want to meet with a sleep specialist and a sleep team and someone who understands your different options. And those will help you get better quality of sleep when you're asleep. And then you work on those things such as, when to use supplements. Some people use melatonin, and you have to be careful when and how often you use that. But that can be helpful for getting you to sleep. More importantly, getting a conducive environment, avoiding eating late, avoiding alcohol, and coffee, and caffeine late, those kind of things have really been proven to help. So thanks for watching this video and checking out the tips today. As I mentioned in the beginning, that even just missing an hour or two of sleep compounded over a period of weeks or months and years can have dramatic effects on your life, swings and impacts on how you feel, how you breathe, mood disorders, anxiety disorders, panic, heart rate spikes. And when people get poor quality of sleep, it's actually been proven in home sleep tests that sometimes your heart rate and your adrenaline can actually spike more during sleep than it is during the day with poor sleep. And that's why people often feel exhausted or tired or just give up on trying to get quality sleep. So there are things you can do so you don't have to continue to live that way. If you have questions, call or text us. So thanks for watching this video, and we'll catch you on the next one.